PACS has been just an unbelievable advance to healthcare up here in the territories. This particular gentleman who had was riding an ATV and had an injury. Flipped over, and what would happen in the past is the nurse or the physician may call and say that the gentleman has a broken bone, and identified perhaps as a femur, depending on the skill set of the practitioner. And they may or may not know whether it was displaced or where it was broken or how it was angulated. Whereas now a picture is literally worth 1,000 words or more than 1,000 words. They can take this picture in the community, and we can see it essentially as soon as it's taken here in Yellowknife and say that this gentleman has a broken femur at the distal third of his femur that's angulated anteriorly and completely displaced, and he needs a treatment for a rod and to make sure that he gets stabilized. Otherwise, with regards to his other injuries, he had no other injuries. We knew right away what he was coming down for, and we knew right away what to prep the operating room for. A lot of the cases are much more subtle as to whether the person actually needs an operation or not. In the more subtle cases, you can imagine how we can decide a lot of the times we look at the pictures and say, no, that person doesn't need an operation. That particular injury should be managed just with a cast or doesn't even need a cast, or yes, that person does need an operation. It's really great for the patients. It's fantastic for us. It helps everybody gets advance warning as to who's coming down. And it's great for the people up in the community because they know right away they get turnaround from us even before they get an x-ray report. They can get us right here. We can see these pictures here and give them feedback as to what to do.
This is very useful for the diagnosis of problems, but from our point of view it's very, very good for management. When somebody calls us and they say they have a fracture, it's not a big problem if it's a very obvious large fracture like this one, but often they have a case and they don't know whether they should send the patient down or treat it up there, and this can be a $15,000 decision because that's what a medevac may cost. This way we can look at the same x-ray at the same time. In the past they'd have to put the x-ray on a plane, send it down, we'd phone them back, and there was a lot of delay. Now we're talking about the same x-ray. So it goes straight to the person who's doing the management, and you may even bypass the radiologist. It's very easy to use, and I imagine it'll get easier. So it's not a problem. In fact, it's easier to manipulate the X-ray. You can zoom in on a film. Whoops, I got. You can zoom in on it. You can rotate the films. You can do a lot of things you couldn't do with an ordinary film. So it's actually better.
You can measure the actual angles on a between the bones if you actually wanted to measure them. It shows you right here how much angulation. That's at a 32.5 degree angle. So there's not any doubt as to whether it was 30 degrees or 25 degrees. Gives you absolutely identical. We do a lot of total joint replacements here, and we template the x-rays right on, it's kind of part of all of this, right on the machine, and it shows us exactly where to make the cut, what angle it's on, and how much bone to take off and what kind of angle we should be looking at. So it really works out really well for us in orthopedics.
I think it's obvious that it saves cost on the films itself and the production. That's what we've been told, but we know it. That it saves us probably every month 1 or 2 flights that don't need to come down. That costs about $15,000 to $20,000 each time. So it's not just better treatment. It does save a lot of money. When you're treating people in a large territory like this, here's 2 orthopedic surgeons, and we can see the X-ray of almost anybody in the territories, or at least we can once they get this system in every hospital. Right now it's limited to about 5 centers. So if any doctor from there calls me right now and says, I need to look at an x-ray, I just say, hang on, I'll sit down at the computer and we'll look at the same x-ray within about 2 minutes.
Yeah, so it's been tremendous for the cost savings on for the avoidance of the medevacs. But even on the other hand, when they think, some people will say, well, they've got this x-ray and I don't see anything. we may look at it and say, no, 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 there's a fracture right through there, that kind of stuff. And that person in the past may not have been medevac, but may have gone on to long-term problems because of a mismanaged fracture or undiagnosed fracture. Whereas now we can see it right now and either reassure or say, no, that's somebody that should be coming down here. So obviously that would be an increased initial cost to the system, but much better management for the patient and probably decreased long-term costs because of the lack of the long-term complications.
Even follow-up, like a simple fracture, just a Colles fracture, you put them in a cast for a month, and then we'll often reduce a fracture like that, and we'll say, get an X-ray in the community in a month, and let us know when it's on the computer, and we'll have a look at it. And barring any clinical complications, if we can judge it on the X-ray, we will. We just said, okay, that's fine, turn him loose. He doesn't have to have the cast. It saves him coming down for repeated visits in many cases.
It's a great system. I mean, I don't think we could go back to working with the the regular films now. Just once we're used to this, to actually have to be running around looking for the films for the people, it's a skill set to try to for the people, the providers out in the communities, to actually describe the X-rays. That skill set's probably been lost, and there's just no comparison. As I say, the picture is worth 1,000 words. It's probably worth more than 10,000. It's certainly worth more than $10,000 bucks, and most of these pictures are saving a lot of money each time.